Morning, it's Dr. Toker, friendly neighborhood colorectal surgeon, and I am proud to announce a sponsor to the show. It's not really a show. My little Instagram channel now has a sponsor. It's called Super Patch, and there is a link in our bio, and we'll post a story or something like that with a little clicky link that gets you to their content. What is Super Patch and how can it help you? And we will discuss it. So they're going to sponsor our weekly live session, the surgical bullpen, where I discuss a variety of different health ailments, how they're diagnosed, how they're treated, what you can do to sort of prevent those things. Super Patch will come up a lot. Why? This is a non-medicated patch. It's a 2-inch by 2-inch adhesive patch with a tactile technology in it. And that technology sends a signal through your skin to your brain to alter a particular neurologic pathway. And each pathway depends on the pattern on the patch. Now, the pattern is so fine you can't see it, and honestly, you can't really feel it. Right now, I'm wearing one on my shoulder. Oh, yep, my little arm. This is one of their new ones. I'm trialing it. It's designed to improve sort of your skin texture. And I'm filming myself, so I thought, well, if there was ever a time to feel luminescent, this was it. And so this is for when you're going out to dinner, you can slap one of these babies on, and it tends to make your skin glow a little bit. And I don't know, y'all can tell me, does my makeup look okay? Do I look happy and luminescent? So these patches are designed to normalize the autonomic nervous system in a variety of different ways. The one I do not leave the house without is called a peace patch. That thing has changed my world. It certainly makes me a better surgeon because it requires an extraordinary amount of patience in an operating room. When a patient's anatomy is complex, the disease is complex, and you're trying to achieve something to as much of a perfection as you can. And most of us, especially colorectal surgeons, they don't call it anal for nothing. It's like we do everything the same way every single time. Not just me. Meet your friendly neighborhood colorectal surgeon. They'll tell you that it's the same thing every single time. And we cannot leave the operating room unless it's perfect. And it can be frustrating when the patient's anatomy and when the disease process impede perfection. I hate that. All surgeons do. So this allows me to just not let my frustration rear its head. I know I seem pleasant on the phone. And my hair is not red, but I got a little bit of the redhead in me. I am a surgeon. And so if things don't go properly, not with the patient necessarily, but I usually can't tolerate fools around me. And so I can't get frustrated easily. And the peace patch really kind of helps me suffer fools a little bit easier, and I love it. And it's blunting my hypothalamic adrenal axis a little bit so that my adrenal glands are not overspun. And now, you may choose to do that not because you have a job that's stressful or frustrating, but because you've got too much stress in your life and it's causing GI upset. So there's a distinct association between the adrenal gland and your GI tract, which is kind of how I meet the Super Patch people in the first way, because I use this in my practice as a suggested additive to people's lives. There's no contraindication. You can give it to anyone, including a child or a pregnant person. There are no side effects other than every now and then you'll get irritation underneath the tape of the Band-Aid. Totally worth it. I could care less. In my life, it is such a bonus and a benefit to me. So welcome to the Super Patch people. And if you have any interest, y'all check it out. It seriously is a life changer. All of their patches, and we'll go over all of them as time goes on, but it is amazing. It's the bomb. All right, enjoy your Super Patches.